All right, guys, this is it. The big finale. Woo, section 20. Well, there is a section 21, but as you guys know, I'm an MD and not a DO, so I don't have the skill set to cover the OMM portion. Please review that on your own. Of course, you should review all of this on your own. This is not intended to be a full review of your entire 1-month pediatric rotation. This is just something I do with all my medical students, and I felt like everybody should have a chance to sit down and go over this with me. Even if it's 10 at night, I'm in my jammies. Everybody should have a chance to have the same review with Dr. Anglin. So please email any questions about OMM to your local OMM staff or to the medical school's OMM staff. If you have questions, I'm sure they'd be happy to help you with those. So let's do pediatric musculoskeletal disorders. So be able to construct a differential diagnosis for limp in a pediatric patient. So trauma, of course, accidental or non-accidental. If it's a non-ambulatory kid, if it's a 2-month-old that doesn't walk, you need to ask why they broke their leg. 2-month-olds shouldn't break their legs because they can't walk or move really. But so that needs to be evaluated. Infectious processes could be viral, like a toxic synovitis in a toddler. Remember when I did the stanky leg, but it was the turkey leg? Y'all remember that in first year? I'm taking you way back. Inflammatory conditions like autoimmune arthritis, developmental conditions like developmental dysplasia of the hip could cause a limp. Also, remember that parents will tell you kids are limping when it's really just a developmentally normal alteration of the gait. So remember, most kids are bow-legged when they initially begin to walk, particularly if they're early walkers. Then they go to a more neutral gait, and then they become more knock-kneed around 4 years of age. That's normal. That's what's supposed to happen. That's not a limp. That's just the way it is. Neoplasms like osteosarcoma could cause a limp, and then metabolic bone disorders like rickets could cause limp as well. Remember the 9-month-old I had with rickets that wouldn't bear weight on his legs? He would have a limp if he would bear weight. He wouldn't walk at all, so he didn't have a limp. All right, recognize the typical history, physical exam, and treatment of nursemaids. So again, nursemaids is going to be a stretching force on the elbow that dislocates that radial head. So grandma was swinging the kid around by the arms, or they grabbed onto the slide and there was a stretch force applied. The child's going to come into the office sitting with their arms sort of like this in their lap. So their elbow's going to be bent. Their arm is going to be facing upward like this. They're going to be sitting with it, kind of hard to show you, in their lap like this, and they're not going to be using it. So they're going to do everything with their other hand, okay? You're not going to be moving this. So typically I play with them a little while. I examine their shoulder, kind of get down to their elbow, and they wince a little bit. I wiggle their fingers and they're fine. I squeeze their wrist a little and they're fine. Then I try to rotate their wrist and then they start wincing. There are a couple of different maneuvers you can do to try to reduce it. There are some great YouTube videos on how to reduce the nursemaid's elbow. I typically hyperextend and then flex. I can't really do it because it's on my own arm. So I'd suggest you go Google and watch YouTube videos of reducing nursemaids so that you can review how that's done, particularly if you haven't seen one reduced in the office this month, which come in fairly often, but not necessarily every month. So best wishes to each of you on your examination. I'll be praying that each of you do your very best. And if you have any questions, please feel free to email me. Again, this is not intended to be a review for the test. I sit down and go over all the learning objectives with my medical students every month. And I wanted everybody to have that same opportunity. So there you have it. Hopefully you'll find this helpful. And if you have any feedback, I'm always happy to hear it. Thanks, guys. Good luck.